Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
One of the most devastating facets of the second wave of the coronavirus pandemic has been a rise in infection among neonates or newly born babies in India. We spoke with Dr. Karthik Nagesh from Manipal Hospitals in Bengaluru to talk about what COVID in neonates look like and how much of a worry it is. How do neonates who haven't been exposed to the outside world contact COVID?
Basically, as you know, newborns are in a cocoon of the mother's womb when they're born and they subsequently deliver. So the infection has to either come from the mother if she has been afflicted with COVID, or after birth, the baby can acquire it from anybody around the baby who's caregiving for the baby. Recently seeing in the second wave of the virus is much more worrying, and that's called the transmission of the antibodies from the mother to the baby. Now, just presume the mother has had COVID and probably she's recovered, or sometimes she may have been an asymptomatic mother with some COVID she didn't even know about. The antibodies which she has acquired because of her natural infection with COVID goes on to the baby. That causes what's called a hyperinflammatory syndrome in the newborn, which can happen anytime from birth to even 6 to 8 weeks after birth, because of the antibodies which have gone. That affects the heart, the lungs, and the whole body system. So that is what increasingly we've been seeing.
Doctor, how with the third wave, there is news that more children and younger people are going to get infected. How worried are you about neonates getting infected further?
It's been estimated that more than 4,000 mothers in the repository maintained by the FOGSI, which is called the Federation of Obstetricians and Gynecologists of India, they have a repository. They have found that a 7 times increase in incidence of COVID has happened in mothers, with high rates of complications during the second wave. So these mothers, when they deliver, the babies will have antibodies passed on to them. So it's likely, we don't know yet the incidence, it's likely those babies can have complications related to the multi-system inflammatory syndrome in the newborn. That is one thing. Of course, one thing is that breast milk doesn't transmit the virus. So on the contrary, breast milk transmits high amount of protective antibodies to the baby. So that should be not discouraged. Breastfeeding should be continued even if the baby is born to a mother who's COVID positive.
Right. And doctor, how would you say mothers can prevent incidents like these happening?
They have to remember that they have to keep themselves safe at home, which means all around them, there is a kind of bubble or a cocoon. Her husband, her parents or in-laws, whosoever, or her own other child, they all have to be maintaining what's called COVID appropriate behavior. They have to be maintaining social distancing, try not to go to gatherings which are likely to be crowded. Especially if the husband goes out to work, he has to make sure he has to come back and make sure if he thinks he's exposed, he has to take precautions. So what I'm saying is, if the mother, because she's not able to be vaccinated, all other adults in the family, if they can be vaccinated soon as possible. The pregnant ladies, the vaccination has still not been recommended yet in this country. So till those recommendations come, she's quite likely to be very susceptible because she's also immunocompromised during the pregnancy period. So we have to make sure that she takes care. The baby starts looking more and more unwell, sicker looking, breathlessness, breathing difficulty, starts looking very kind of hands and feet start feeling very cold, or the child gets diarrhea, severe vomiting. These are all what is called warning symptoms and signs in a newborn baby who could be having what's called a multi-system inflammatory disease of the newborn due to COVID. We have to take the baby to the hospital soon as possible. Now, COVID has come here to stay. For the next 1 or 2 years, we have to think that any unusual illness in a newborn child should be a high index of suspicion unless people around the baby have all been vaccinated and are quite asymptomatic otherwise. So we have to accept this and have a standard COVID appropriate behavior when looking after newborn babies.
As pediatricians and doctors all over the country gear up for a very possible third wave, doctors emphasize that it is more important than ever to follow COVID appropriate behavior. This is Vaishnavi Suresh, and you're watching Mojo Stories.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.